And we are live. Welcome to our Facebook Live. Today, we are going to talk about what it's like to have an initial hearing evaluation at Kazmarski Hearing Services. There's hearing tests available all over the place. You see advertisements for free hearing tests, for things that are like, well, why would I want to pay for a hearing test if I can get it for free? Well, there's a lot that goes through an initial evaluation of your complete hearing system. A free hearing test is probably not as valuable as you might want it to be. There's more that goes into a hearing evaluation than you might think. So today I'm going to talk about that with you. One of the most impressive things that I think you'll find when you call Kazmarski Hearing Services is that you will talk to a person, and we will answer the phone right away. You won't have to go all the recordings and the press the numbers, and if you talk English or Spanish or anything like that, you will talk to a real person right away. And not only that, the person you're going to talk to really knows what they're talking about, and they're the best support staff that I could ever imagine. So I think that you will see that the second you get on the phone with one of our support staff people, that you'll see that you matter and that we listen to you. So I'm very proud of that fact. So that's what happens when you go to a private practice instead of a big giant conglomerate. You get a personal feel. So one of the main reasons I'm talking today is to let you know why a hearing evaluation shouldn't be free. There's so much that goes into it that you need to be aware of. So when you call, you'll get one of our wonderful support staff people on the phone, and we will ask you what your needs are and that kind of thing. And we'll schedule your appointment at one of our 4 locations. So that's another thing too. We have locations that are convenient for you. You don't want to be driving downtown and parking and wondering where you're going. We're pretty much in each quadrant of the city, so it would be very convenient for you to be able to make an appointment at one of our locations. We will ask you also for your insurance information over the phone. Insurance companies are tricky these days, and this is a courtesy that we provide for our patients, because insurance policy is really between you and your insurance company. We're just doing a courtesy to call your insurance company for you to let you know what your benefit is. Most of the time, a hearing evaluation will be covered by your insurance under the medical portion, but you may have a hearing benefit for hearing aids and that kind of thing. We want to make sure we can give you better estimates about those things too. So we will check your insurance for you. It's not a guarantee of benefit, but it's something that we will educate you as best as we can. If a Medicare will cover a hearing test, if you have a doctor's referral, your doctor has to actually put in the system that they want to have a hearing test done, and then we can bill for the hearing test for Medicare. So after we check your insurance, we make the appointment on our books, and we schedule usually that week. When you call in, you don't have to wait a week or two for an appointment. We can get you in fairly soon. And when you make your appointment, we have a packet that we send to you ahead of time, so you can fill out your paperwork, which lots of doctors' offices have, but it's a really good reason for this paperwork, is that we treat you individually. You are not just a number here. We need to know your information. It's very important for us. So this is the packet that you will get. And there's a few things in here. It's very important that you look at everything in here. It will show you when your appointment is, and what office, that kind of thing. And the next thing in your packet would be a bio of the audiologist that you're going to see, a little bit about the professional that you're going to see, and a little bit of information about the location that you'll be going to. So it's nice to know ahead of time who you're seeing and where you're going to be looking for the location. Then we have you fill out a patient registration form, and it's got all your information on there about your name, address, and birth date and that kind of thing, your insurance companies. And then on the second page of that is your health history, which is your prescriptions and your health history. If you're diabetic, if you have arthritis, if you ever had a head injury, ear infections, and a little more information about your hearing itself and your own experiences. Because I say it all the time, we can see 50 people with the same hearing test, and you'll all do differently, because we're really working with the brain, and we're working with your environment. If you work outside or inside, or have a hard time with high frequencies or low frequencies, it's all different depending on your environment. So everybody's very, very unique. You'll also get a copy of our financial policies. That way we have no questions, or everybody's understanding what is needed for financial. Also a HIPAA form that all offices have that lets us know who we are able to talk to. This is a very important form. A lot of times when when you maybe your mom is 80 or 90 years old and you want to call and ask if her hearing aid's back from repair, if your name's not on the HIPAA form, we can't talk to you about your mom's hearing aid or hearing loss unless your mom gave us permission to talk to you on the HIPAA form. So it's very important. HIPAA form in our office is very, very important. And the last thing you'll get in the mail is called a SAC, self-assessment of communication. And that's going to go through some questions that will allow us to know where you're having difficulty hearing. For instance, do you experience communication difficulties in situations with speaking with another person at work, while watching TV, coworkers, background noise? Where do you want to hear better? Those kinds of things. Does the hearing loss worry or upset you? To what degree? There's some nice questions in it. It really give our audiologists a head start on what we need to do for you, and even specific testing that we might want to do. So when you come in for your appointment, our friendly front desk staff will take your paperwork and get you checked in. The audiologist will come out to get you, and they will first take you into their personal office and do a case history, talk to you about the forms, and if you have any specific questions or concerns, that's where you talk to your audiologist about that. And then we take a detailed look inside of your ears with our otoscopes and their video otoscope so you can see too. And then we go into the test booth and we do the testing. The testing is, we test several things. We test how loud things need to be, how soft things need to be. That's called threshold. We test the right ear, the left ear separately. We test them together. We also test how your brain is interpreting sound and how clear things sound to you. That's called speech discrimination. We test the air conduction thresholds through the headphones. We also put something behind your ear called bone conduction testing. That kind of bypasses all the mechanics of the ear and goes straight to the nerve. And we compare the air conduction thresholds with the bone conduction thresholds to see how the sound is entering into your system, to see if it's more of a mechanical hearing loss, which is conductive, or if it's more of a nerve hearing loss, which is in the nerve. So we look at all those things, and that's one of the reasons why it's not free. It's a detailed look at your hearing, and this hearing is more than just the ears. It's how the sound is being transmitted into your ears. But what is your brain doing with the sound after that? Then we print the results, and we show you. This is a detailed report that goes to your doctor's office, or to anybody that you want the report to go to. But what you'll see on here is the red is right, the blue is left. We touch each ear individually. Down here are some speech, normal, comfortable levels, uncomfortable levels, speech clarity, speech discrimination, speech reception thresholds, and speech and noise testing. And on here also is the bone conduction testing as well. So we do a detailed report that goes to your physician, and these are official medical records, and it's something that's really important to have a baseline hearing test done that's in your medical records somewhere so you can see if anything's changed. Maybe your hearing is fine, or maybe you have a pattern of a noise-induced notch, the 4,000 hertz, which we want to watch things and see the pattern of that over time. So even if your hearing's normal, you still want to document that and get that on paper so you can see that that is documented, that you have normal hearing. And if something should happen, maybe you get an accident or some explosion happens, you want to document that you had normal hearing at one time, and you can see the changes if something should happen. Even people with cancer patients who are on cisplantin or any type of chemotherapy, we watch the hearing test very, very, very carefully, because that is an ototoxic situation where it will change people's hearing. We need to watch that, to what degree. So hearing testing is our first step. It's something that's very, very important, that it should not be free. I don't think you're going to get the experience with a free hearing test that you will get here at Kaczmarski Hearing Services. So I want to make sure that you understand how much that really matters to our staff, as well as to your family, and as well as to your physician, so they see that these things are being watched. We watch for things like anything from aging ears to infections in your ears, all the way to looking for brain tumors and things like that. So it's a serious thing for us. So I really appreciate you watching. I hope this encourages you to get your hearing test done and do it the right way. That's what's important for us. So thank you very much, and we'll see you again next Wednesday. Take care.